Okay, so I'm going to talk about the relationship between mental health and drug use, a topic that I know comes up repeatedly when we talk about drugs. Much of the research has found high levels of mental health issues, such as depression and anxiety among gay men. We've used the standard measures for these in Flux, but the study wasn't actually set up for this purpose. Even so, we can certainly investigate mental health within the cohort. Also, a lot of research has indicated a strong association between risk behaviours, drug use and poor mental health. Australian data have been much less clear on this though, particularly among gay men, although Lim and Mao from the Social Research Centre in Health did some good work on depression and HIV status a few years ago. However, there hasn't previously been a study with the capacity to explore the topic in this kind of detail, particularly in relation to drug use, until, of course, Flux. Here we can see the basic prevalence of anxiety and depression in the adult male population on the left. About 1 in 20 experience depression and 1 in 10 anxiety. In Flux, however, you can see that the rates are much higher. About a quarter of the men in the study experience anxiety and similar proportions depression. Men who participated anonymously or didn't complete a follow-up survey were somewhat more likely to experience both, but the differences were nowhere near enough to account for the differences with the general population. So what were the sorts of things that were associated with anxiety and depression? Interestingly, not HIV positivity, which actually reaffirms the earlier findings by Gamin. However, men who not been tested for HIV were more likely to experience both anxiety and depression, but other basic demographic factors such as younger age, lower education, being unemployed, and not being in a relationship were all associated. And these are the sorts of socio-economic factors that are commonly associated with poor mental health. When we consider some of the more personal characteristics, it may be surprising that gay identity is not associated with anxiety or depression, or rather I should say non-gay identity. However, there are other aspects of gay social connectedness that do appear to offer some protection against mental health problems. Having gay friends, involvement in gay community life, being personally supported by friends and family, and being more open about your sexuality. Interestingly, seeing oneself as masculine also appeared to be quite strongly protective. I don't necessarily want to go into it. When it comes to sexual behaviour though, and particularly all of the indicators of risky sex, there was simply no association with either depression or anxiety. Except that men who engaged in group sex tended to be less anxious in general. This tends to contradict much of the literature, particularly the North American literature, that tends to assume an association between risky sex and poor mental health, although it actually confirms some earlier Australian data that suggests there was no such relationship. And it has to be said, many of the assumed relationships in the literature aren't really all that well supported by the evidence anyway. So let's get to the heart of what Flux is really about, drug use. And was there an association between mental health and drug use? Well, the short answer is no, not really. In terms of illicit drug use, use of none of the drugs in the previous 6 months was associated with being anxious or depressed. Use of one drug, GHB, did seem to be associated with being less anxious. That may just be a statistical blip. But this particular issue will come up again later in one of Mo's presentations. However, if we look at the legal drugs down the bottom, you can see that recent tobacco use was strongly associated with both anxiety and depression. That's probably not the drug that everyone was thinking this particular talk might focus on. But that was just a very superficial examination of the issue. With Flux, we can look at it in some more detail from various angles. And here we're looking at whether the frequency of use may be a factor in gay men's mental health. This is just looking at the men who used each drug in the previous 6 months and comparing at least monthly use with less frequent use. For the most part, mental health doesn't appear to be a factor. However, regarding cannabis use, more frequent use is strongly associated with both anxiety and depression. This is also true for both tobacco and alcohol, at least with respect to depression. It's probably worth noting that those particular drugs are the most commonly used, and the numbers of frequent users of some of the other drugs are not that great. So it may well be that in some cases we're simply not finding an association with frequent use simply because there aren't enough of them. But we have other ways of looking at this influx. In this case, we're using the standard severity of dependence measure that Mo was referring to earlier in relation to crystal use to identify whether mental health is an issue for crystal users who show signs of being dependent users. And that certainly does appear to be the case, with dependent users being about 3 times more likely to experience anxiety or depression than non-dependent users. Returning to the measures of anxiety and depression though, first we conducted a multivariate analysis to determine what factors were associated with anxiety disorder. After controlling for everything else, those who experienced anxiety tended to be younger, not in employment, not in a relationship, lacking personal support from friends or family, and not viewing themselves as masculine. It comes up again. The findings were similar with regard to depression, although age and masculinity don't appear to be as significant a factor as they were for anxiety. But notably, having fewer gay friends was also a predictor for depression. So basically, for both anxiety and depression, the key factors seem to be the standard socioeconomic factors that are usually associated with poor mental health, coupled with a lack of personal support. Individual factors around self-perception of masculinity seem to play a role in the experience of anxiety, whereas social engagement with gay community may have more impact on the experience of depression. So let me try to summarise what we've found so far and what we think it might mean. The overall prevalence of anxiety and depression among the men in flux is high, and it's particularly high among those men with the same sort of lower socioeconomic factors, indicators that are usually associated with poor mental health. That said though, younger men and men who feel less masculine tend to be to have more anxiety, and men who are less socially engaged with gay community tend to have more depression. HIV positive status and sexual behaviour, including risky behaviour, are not associated with mental health, nor is illicit drug use for the most part. That said though, there does appear to be some indication that more frequent or dependent use of some drugs can be associated with anxiety or depression. This was notable in regard to cannabis and crystal, but with greater numbers, it's possible that the same issues of frequency and dependency might also apply to some other illicit drugs. On the other hand, with regard to the legal drugs, daily smokers and high-risk drinkers were much more likely to experience both depression and anxiety. Overall then, anxiety and depression are issues for gay men, but they mainly affect more socially isolated and marginalised men. That's probably not surprising. What may be more surprising is the lack of association between mental health, sexual risk, HIV and illicit drugs in general, even though it does tend to confirm previous findings among Australian gay men. Nonetheless, it's important to remember that what we're doing here is looking for the drivers of these issues at a population level. It tells us about how we need to think about these issues in planning the kinds of services and how they are targeted. But it doesn't tell us about individual experience. Individual men who, while all their friends may be doing well, nonetheless don't do so well. And their mental state is such that they get into all sorts of difficulties, whether that involves drugs or sex. And we can see some of that very issue when we look in more detail at the association between drug use and mental health, where we can see that being more dependent on the drugs and using them more frequently appears to be a particular issue for understanding how depression and anxiety are experienced by some gay men. In particular, it's worth considering how drugs are experienced among gay men and the possible implications for that minority of men for whom that experience may be more problematic. Overall, we'd have to say from these data that for most gay men, their drug use seems relatively functional and mostly has little impact on their mental health, despite the fact that anxiety and depression are both widely experienced by gay men. However, there's clearly a minority of men for whom that's not the case, and they do appear to be somewhat isolated and marginalised. This isolation is probably somewhat exacerbated in a context where for other gay men, their experience with drugs doesn't seem to affect their mental well-being. Not doing so well on that score probably only makes them feel more alone. To some extent, this is just hypothesising on my part, but I do think this is what the data tend to suggest. And it does make me think back to some of the early safe injecting campaigns that targeted gay men with messages about taking care of each other. And it also reminds me of Akon's Mates campaign from about a decade ago, where one of the iterations was specifically about taking care of each other while using and partying. Those are great messages for the majority of gay men who are connected to strong gay friendship networks. But it's more complicated when we try to think about more disconnected and isolated men. I guess we need drug rovers for the community, not just for the parties, but I don't really know what that looks like.